Hello, I'm Bill Patten, Interim CEO here at Rehoboth McKinley Christian Hospital. I want to give you a report from the board meeting that was held on October 23. This was a regular board meeting, but it was unusual in that the board immediately went into executive session after calling the meeting to order and approving the agenda. The board had three important topics that it needed to discuss in private conversation before it went into its regular meeting. The three topics in general terms: one was related to pending legal action. Our legal counsel needed to update the board on what that action was, and also provided education to them on issues around that potential legal action. Board also talked about nomination for a new board member. We've had an application, and there were questions regarding a potential conflict of interest. And so the board talked about that. And then the third topic was a discussion about a recent interview for a permanent CEO candidate, whether or not the board wanted to make an offer to that candidate and what that offer would look like. So those three topics were discussed in executive session. The board was in the private conversation for well over an hour before they adjourned from that and went into the regular meeting. Once they began their regular meeting, they reviewed the minutes from past meetings. They reviewed and accepted minutes from the Medical Executive Committee, from the Credentials Committee. They approved the credentialing recommendations made by the medical staff. There was no Finance Committee meeting this past month, and they reviewed and approved the report from the Quality Committee meeting. During the regular session, they also had a report from Rebecca Martell, our Chief Human Resources Officer. Rebecca gave them updates regarding some of our recruiting and turnover statistics, which have improved remarkably over the last couple of years. She also gave a report on a recent benefits fair. One of the things we had heard from our employees during the engagement survey that we did about a year ago was that they had some concerns about our benefits. So we have made some improvements to the benefits, and this benefits fair, which was attended by almost 40% of our employees, which is a very good percentage, is specifically designed to address those concerns that the employees had. She also reported that on exit interviews, more than 90% of our employees would recommend Rehoboth McKinley as a good place to work. We also had a report from the Quality Committee. The board specifically wanted Jeff, our VP of Quality, to thank Mohammed, our new IT director, for the report that he gave during the Quality Committee meeting. The board was very pleased with the many projects that Mo has underway and the many initiatives to get our IT department addressing some important initiatives. An example would be we need to have a second connection to the internet so that when our primary internet connection goes down, we're not left without access to our EMR. And that's one of the projects that Mo has at the top of his list. Our representative, Eric Jones from Ovation, gave the board a very detailed overview of September financials. I think it's been since the last board meeting that we had a turnover in our interim CFO position. Chris Dover, our previous interim CFO, is no longer with us. We introduced a new interim CFO, Steve Miller. We are recruiting for a permanent CFO, but the fact that we don't have a permanent CEO limits our ability to get a permanent CFO. So we have another interim, Steve Miller. He started just this week. But Eric took the lead in presenting information related to our financials, as well as work that we're doing for the budget that we're preparing for fiscal year 2025. In my report to the board, I began by reporting on a number of medical staff related topics. We were sad to report to the board that a cardiology candidate that we had interviewed last month has not accepted our offer. She accepted the offer to another hospital in another state. We potentially are going to have another cardiology candidate referred to us by a member of our medical staff, so we're anxious to move forward with that connection. And in the meantime, while we're looking to have a permanent cardiology presence, we are vetting a televideo cardiology company. This is a company that provides cardiology support for us. It would mean that we would have 5-day-a-week cardiology coverage, but the doctor would be remote, much as happened during the COVID pandemic. Much of the care that was provided was done remotely. So this is an interim step for us. Our ideal model is to have a permanent cardiologist here in Gallup working on the medical staff, but until then, the televideo may be an option that we need to pursue. Also reported that we have made an offer to a family medicine physician. We are waiting to hear whether or not she has accepted that offer. We have given her until the 8th of November to decide whether or not she's going to accept, and if she doesn't, then we will be moving in another direction. On the finance front, I gave the board an update regarding a number of the different aid packages that we received from the state and the county as a result of this last legislative session. So the first one, I call it the payroll support package. That was $12 million. We have received all of that money. It has flowed through the county and the city. We have used part of that to repay part of our past due rent to the county. So all of the $12 million has been received. The $15 million, what I call the debt relief package, we have received about $4.2 million of that so far, and all of that has been directed to one vendor. This vendor was a staffing agency. We were able to negotiate a discount of about 23% on the total amount that we owed. And then we have 2 other payments that we have negotiated that will come out of that. So as that $15 million flows to us, we are staying ahead negotiating with companies, so we aren't paying typically dollar for dollar, but we're getting a discount on those. And then the third bill was Senate Bill 161. That will provide us with a total of $5.7 million spread over 2 years. The plan was that we would start getting money in October, $1 million a quarter for this year, and then next year, $1.7 million. As is common with projects of this type, things are behind schedule. We don't have the contract with the state yet. So the $1 million payment we had hoped to receive in October, we won't be getting until November. But all of these projects are helping us to address our long-term financial viability and help us to dig out of the hole that we had been in following the pandemic. Also gave the board an update related to our efforts to adjust to our daily cost and our daily expenses. We have made the decision to sort of standardize our billing process. We use one company today for coding, a different company for denials management. We're going to centralize and put all of that effort under one umbrella. We've signed a contract with a company called R1. They will assist us with rebuilding the billing module of our electronic medical record in our Cerner system. We are not eliminating, we're not laying off any of the staff in the Patient Financial Services Department or the Health Information Management Department. There is more than enough work, even with the efforts of R1. So this is a 1-year contract. It's designed to address some of the long-standing issues we've had in patient billing and allow us to get our feet under us. And then a year from now, we will evaluate whether or not we want to continue with R1 or whether we want to internalize the billing efforts on our own, having had a year to get everything in order. And then we're going to be holding a foundation board meeting. At the last hospital board meeting, the board appointed 3 individuals to serve as a starting point to reconstitute the foundation. So we'll be meeting with those 3 people in an effort to get a complete foundation board established. Our initial focus is not going to be on fundraising. It is going to be on getting the foundation board back in service, designing what the priorities will be for the foundation So this will be a many months effort to get the foundation started, but this first board meeting will be an important one. On the operations front, I reported to the board that we are seeing lower volumes than is normal for this time of year, both on the inpatient and the outpatient side. And some of those volumes are related to patients that don't show up for scheduled appointments. So I'll put in a little plug here. If you have an appointment and you're not able to make it, please call so that we can get you rescheduled. Otherwise, someone who needs that time won't have access to it because we're expecting you. So you can help us reduce our no-show rate. So that would be very much appreciated. If you've been following the news, you would know that as part of the Hurricane Helene damage, a couple of plants that produce IV fluids were damaged, and the national supply for IV products has been in jeopardy the last several weeks. Our team, both in pharmacy and materials management, has done a great job keeping us with adequate supplies going to alternate vendors. So we gave the board an update, and it looks as if we will be returning to normal. We did not have to cancel any elective surgeries. We never had a shortage of product, so that was good news to be able to report to the board. I've already reported that the board was very pleased with the work that Mo in IT is doing. Two specific projects we updated the board on. One is what we're calling the Cerner Uplift project, where we're rebuilding some of the software that we currently have. We're installing new software, and then we'll be training or retraining our staff on how to best use the system. So that's one big project. And then I've already mentioned that we're working to get a second connection to the internet so that we should rarely, if ever, lose access to the internet unless the internet overall across the country goes down. We have been working on our length of stay issues. As a critical access hospital, we are required to closely monitor our length of stay. This was a new requirement for us, and so working in partnership with the medical staff, that's a project that we've been working actively on over the last couple of months. We're going to be providing an annual review of services. As a critical access hospital, that's something we're required to do to the board every year. The board needs to evaluate whether the services are meeting the needs of the community. So we'll be sending that out to the board in the coming weeks, and then at the next board meeting, we'll be discussing that with the board, and then they will be giving direction as far as what adjustment to services needs to be made based on that report. Gave the board a couple of updates related to our plant operations. We've been working to get our elevators upgraded, but we initially were behind in making payments to the elevator vendor. We have reconciled that, so we are now current in our payments, but now the vendor finds themselves short-staffed. So it will be several months before we're able to get those out-of-service signs off of our elevators. With funding that comes through the county, we're doing major upgrades to our heating and air conditioning systems, including the control systems. And then with our own money, we're replacing the heating and air conditioning systems in 5 of our clinic locations. And then the last thing that I'll mention during this report, we are starting to do blood drives here at Rehoboth McKinley. And the first one will be next week. And I am pleased to report that all of the slots have been pre-scheduled. We are hoping that some of the hospital employees will be able to pop in for a spot here and there, but it's very exciting that we're going to be able to serve the community by literally giving of ourselves and having a blood drive that we will be doing then on a regular basis here at Rehoboth McKinley. Hope you found this update to be useful. As always, give me a call if I can provide additional information. Thank you very much.